Healthy Diversity, sponsored by the Center for Closing the Health Gap.
Good afternoon once again. The Center for Closing the Health Gap hosting its annual Health Expo in just a few weeks. Area providers are teaming up for screenings and education. One of those that will be joining us at this event, Dr. Odaime Casada. She is with the Christ Hospital Women's Heart Center. Good afternoon to you. You will be out at this event sharing what with women?
Yes, we're very excited that we'll be part of the this expo that is coming up. This is our third year in a row where we will be monitoring blood pressures. We know that hypertension and blood pressure is one of the main risk factors for heart disease. And we're also very excited that we're going to be part of the Black Women Health Experience, where we get to share with Black women, what are the risk factors? How can we reduce the risk of cardiovascular disease in our Black community? So we're very excited to be part of this event.
I know one of the specialties that is your focus is that small vessel disease. Can you share a little bit with me about sort of the difference often that you find in women's heart disease compared to men?
Yeah, one of the things that we always share is that there are differences when it comes to heart disease in men and women. And one of the diseases that happens to be more common in women is exactly what you mentioned, which is small vessel disease of the heart. Essentially, these are patients that have chest pain, very similar to the chest pain that people with significant blockage of the heart arteries get, but they have absence of blockage of the heart artery. So it's really a disease of the small little vessels that we can't see. And many times it takes an expert to be able to diagnose and treat that disease. And it's more common in women, 70%.
Interesting. Well, we have just a little video of the Health Expo. Can you share with me some of the importance of screening? Because as you said, you might not even know that you have small vessel disease.
Yeah, so screening for cardiovascular disease is very important. And we know that heart disease is the #1 cause of death in men and women in the United States. And we need to screen for risk factors. So what are the risk factors that we're going to be screening for at the Health Expo? High blood pressure, so hypertension screening is going to be a critical component of what we will be doing. It's also important to know other numbers when we talk about screening. A lot of these we obtain through the blood, through a blood test. And that's our cholesterol numbers, our sugar numbers. And also during the Health Expo, we're going to be collecting in certain stations weight and BMI. So these are all important factors that help us be able to risk stratify each individual and tell them how high is your risk for future cardiovascular disease.
Yeah. All right. Final thoughts. One of the things that you have stressed is that this is not your grandmother's heart disease anymore. We're going to put up some Health Expo information, but talk to me about that.
Yeah, heart disease used to be thought of a disease that affected older people. It used to affect our grandmothers, our grandfathers, but now we're really realizing and learning that heart disease, unfortunately, is a disease that affects people across their life course. So heart disease is actually the #1 cause of death of new moms. So more new moms are dying of heart disease than anything else. And it's also affecting, we're seeing an actual increase in heart attacks in young women and men. And these are people younger than 50 years old, which usually you don't think of heart disease in someone that young. And so that's what I mean when I say this is no longer our grandparents' disease. This is something that we need to be screening for at a very young age, especially if we have risk factors.
Yeah, excellent. All right, we will look forward to seeing you Saturday, April 27th, 10 to 5 in Washington Park for that Health Expo. Thanks for all that you do in this community to help save lives.
Thank you, Liz.